everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. I am actually shooting this video during the coronavirus pandemic that we have here in the world, and I just wanted to say I hope that all of you are being safe. I hope your loved ones are being safe, and I really hope, and I'm very, very hopeful that all of us will get through this in the end. So just keep that in mind and make sure you maintain your distance and avoiding contact and staying home as much as you can. So having said that, I'd like to talk today about masochism and avoidance and how they tend to go hand in hand in transgender community. Now, what do I mean by masochism? So let me be clear. There is a masochism defined in a sense of getting a pleasure, sexual pleasure primarily, out of pain, right? So for example, when you like to be dominated or when you like to have pain inflicted on you in order to receive sexual pleasure. I'm not talking about that type of masochism. I'm not talking about sexual masochism. I'm talking about masochism that I tend to observe consistently again and again and again in trans community. Now, what kind of masochism I'm talking about? I'm talking about tendency to, in the beginning, when you experience gender dysphoria, you're experiencing tremendous amount of psychological pain because of restrictions in your environment, restrictions in your life, or any kind of obstacles, or any kind of things that prevent you or make it very difficult for you to come out and to do anything about your life, to maybe even take transition-related steps. As a result, what happens is that you start to endure pain. You start to endure psychological pain on daily basis. I'm not saying that as it continues, you start to getting pleasure out of it. There's nothing pleasurable about being able to sit through dysphoria or being able to live through dysphoria, absolutely nothing. But it is a masochistic defense in a sense that after some time, I've seen people get accustomed to enduring pain. Now, again, I'm not saying that enduring pain leads to pleasure, not at all. What I'm saying is that after some time, you get so good at enduring pain, different kind of pain, psychological pain, emotional pain, pain related to hopefulness or hopelessness, that as a result, you sink into avoidance to do anything about your gender. And what I mean by avoidance, that's when you start avoiding coming out, that's when you start avoiding transitioning if that's your goal, and that's when you start avoiding telling your loved ones your true gender identity. You start avoiding yourself. You start avoiding your own inner self because masochism in you, to this point, has gotten so far that your mind tells you this. I have endured this for X amount of years. Why not just endure it for some more years, right? Does this sound familiar to you? I'm sure it probably does for a lot of you. Especially the older you are, the more familiar you'll be with this. I see masochistic tendencies in all of the trans people regardless of their age, but especially with the older generation. The older people are, the more they struggle with it and the more they struggle to break out of this masochistic tendency. And that's because you're looking in the past. And even though it was really painful, you have history of being able to live through it. And you forget how painful that history is sometimes. You forget how incredibly painful it was maintaining that in that moment. And all you see is 5-10 years of living with dysphoria. And then you convince yourself that maybe you can live for the rest of your life like that, and you sink into avoidance, and that's not good. Not only is it not good, it's not helpful, and it's not healthy, because then you're perpetuating this masochistic defense. Then you're perpetuating this taking on pain onto yourself. And I see this all the time. Trans people they have mastered, all of you have mastered masochism at this point. All of you know how to endure huge amounts of pain. And that is not okay, and that is not necessary. And I really want you to break out of that cycle, because enduring and continuing on this path will eventually lead to some really bad outcomes such as your body starting to become symptomatic, you start developing some kind of other illnesses. And I'm not just talking about psychological illnesses such as depression, anxiety, and suicidality that people do develop. I'm talking about when literally your body is starting to fall apart, when you start getting some severe diagnosis, because I really strongly believe that our body and our mind are interconnected. And so when our mind is completely out of order, is completely in this place of enduring a lot of pain, it will start manifesting and showing up in other parts of our body. I strongly believe that. Not always. There are a lot of organic disorders, but a lot of times that's how it manifests. That's our body way is telling us that something is not right. So keep in mind that what you're doing, enduring pain, is really you're being masochistic towards yourself. You don't have to be masochistic towards yourself. There's no need to be masochistic towards yourself. And the more you're masochistic, the more the avoidance becomes a partner of that masochism. They go hand in hand, and that's the problem because that's what delays your transition. For majority of trans people, transition is the goal. Whatever the transition looks for you, maybe it's all of the surgeries, or maybe some of the surgeries, or maybe just hormones. But for majority of trans people, transition is a goal. It's a medically necessary treatment to help you deal with dysphoria. So the longer you engage in masochism and avoidance, the longer you delay medically necessary treatment to get better. Medically necessary treatment to get rid of gender dysphoria. So hopefully this helps. Let me know in the comments below if this is familiar to you. I'm sure that a lot of people don't tend to really put a name to it, and a lot of people don't recognize that it is being masochistic, but it is truly being masochistic, and it's really painful, and it's long-wrenched, and sometimes you forget that you're even doing it. So comment below, let me know how these masochistic tendencies have prevented you from moving forward, have caught you into this avoidance stance, and comment below how you got out of it. I would love to hear what you did. I would love to hear what helped you out. And I bet probably one of the things that helped you out is starting transition, or starting to come out, or starting to take control of your life. So comment below. Love to hear from you. And again, I hope all of you guys are safe out there, and I'll see you next time. Bye.